Hello, everybody. I am Dr. Steve Johnson, and I happen to be a professor of psychology at Columbia International University and the clinical learning and development manager at SCAD, a fantastic alcohol and drug addiction treatment institute located in Connecticut. And I want to welcome you to our webinar today entitled Healing Words, Avoiding Nocebo Traps in Psychotherapy. I want to look today at placebos and nocebo and how we can deal with them within psychotherapy. So let's get started. So first, let's look at what are placebos and nocebos, or placebo effect and nocebo effect. The placebo effect and nocebo effect are the psychological phenomena where a person's expectations about treatment influence their experience and outcomes. So in the context of psychotherapy, these effects can be highly, highly relevant because the client's beliefs, both positive and negative, or helpful and unhelpful, can significantly impact their mental health progress. So let's look at placebo. Placebo effect, how do we define it and what may be the benefits within psychotherapy? Well, the placebo effect occurs when an individual experiences a positive therapeutic outcome due to their expectations or beliefs, thoughts about the effectiveness of the treatment, even if the treatment lacks any kind of active components directly responsible for the improvement. In psychotherapy, the placebo effect can be highly beneficial and is a component of building that common therapeutic factors such as hope or therapist support and rapport building. And the ways in which placebo effects can be beneficial or helpful are as follows. There are many of these, and I want to look at 4 or 5 of them. There are many, many, many of them, but let's just take a look at these. And then if you have any questions, we can certainly go into others. One way that the placebo effect is helpful in psychotherapy is that it can enhance the therapeutic client. If the client has positive expectations about therapy, they can strengthen trust and rapport, helping the client to feel more supported, safer, and open to change. Another way that the placebo effect can be helpful is that it can foster hope and optimism by focusing on positive outcomes. Clients become more motivated to engage in the therapy as they begin to expect improvements in their mental health. A third way that the placebo effect can be helpful is it increases engagement. Clients are much more likely to put in effort, considerable effort, or invest in effort in treatment when they expect that it will work, leading to better adherence within the therapy, in doing the exercises within session or homework between session, to make even making lifestyle changes. One that is really, really an important way that the placebo effect is helpful is that it can reduce symptom distress. A positive outlook can reduce potential distress, as clients may experience decreased anxiety, decreased depression, or any other symptoms that don't feel really great, through belief in the efficacy of the therapeutic progress. And then another way that is really important, especially to those of us who engage in cognitive behavioral forms of therapy or behavioral forms of therapy, is that the placebo effect can promote behavioral change. With the hope and the expectation that change is possible and reasonable, clients are more likely to practice skills and that they learn within the therapy, which often will accelerate their progress. Let's now kind of shift over and say a few words about the nocebo effect. How is it defined and the detrimental impact that it can have on psychotherapy? The nocebo effect is the counterpart to the placebo effect, where negative expectations actually result in worsening symptoms or perceived lack of progress. In psychotherapy, the nocebo effect can emerge when a client expects therapy to be ineffective or focuses excessively on negative aspects of the experience that impedes or gets in the way of improvement and reinforces thereby mental distress. So let's look at the ways in which the nocebo effect can be unhelpful. One clearly unhelpful way is that it reinforces negative expectations. If clients expect therapy won't work, they may kind of subconsciously undermine their progress, hindering the development of a more positive outlook that would be helpful in the placebo effect. Two, it can increase symptom awareness. Now, symptom awareness, of course, is important. However, an excessive focus on symptoms may amplify their intensity, creating a cycle of distress that may be difficult for the client to break. Another way that nocebo effect can be maybe unhelpful, is that it may impede motivation and engagement of the client. When clients doubt the benefits of therapy, they are less likely to put in effort to the therapeutic exercises, which thereby would limit progress potentially. Fourth, kind of an important way of the negative effect of the placebo that we see is that it may encourage client defeatism. Expecting failure can often lead to resignation. Having clients believe that, or have the feeling that they have no control or potential for improvement in their life or by being in psychotherapy itself. And then another one is that it may strengthen negative cognitive patterns. And again, as a practitioner of CBT and REBT and some of the third wave models, I tend to focus on what those cognitive patterns are. And so persistent focus on negative outcomes solidifies maladaptive thought patterns that contribute to any number of unhelpful negative emotions, such as anxiety, or depression, or other mental health challenges. Okay. So, having looked at those factors, I want to shift to factors that contribute to the nocebo effect within psychotherapy. And one of these, which is very, very important, and I've been looking at this for a number of years, is adverse childhood experiences, or what we call the ACEs score. Adverse childhood experiences, we mean trauma, neglect, abuse, or abandonment early in childhood. And these, we count up those incidences and we get an ACEs score, and we know that high ACEs scores, often due to those trauma, neglect, abuse, abandonment, whatever, can predispose clients to become more prone to expecting failure or disappointment, which can lead to distrust in the therapeutic alliance, in the therapeutic process. Another related issue is attachment issues. Poor early attachments can predispose clients to be very wary of trusting the therapist, expecting a lack of support or understanding on the behalf of the therapist. Also, if there is a long history, not going beyond childhood, a long history of neglect or abuse, clients with this history may interpret therapy as just another environment in which they are going to feel invalidated or misunderstood. And so there may not be any investment there. Or if the client experiences prior failures, therapy failures, um, if they experience that previous therapy is unhelpful or even a harmful experience, um, that can lead to skepticism or even hopelessness about future therapeutic settings. And then finally, um, a kind of a cultural issue, a social issue is mental health stigma. Mental health stigmatization is there. It is a live, real thing, unfortunately. And clients who have internalized the stigma about having mental and emotional and behavioral challenges may doubt their own worthiness to even receive care. They may think that they're not worthy of care, and which may create a barrier to any benefit from the treatment itself. There are ways, and would be remiss if I didn't cover this, that therapist role in reinforcing nocebo effect. There are several ways that we inadvertently do this, right? I don't know any therapist that deliberately does such a thing, but it happens. And being aware of that can help us to kind of avoid reinforcing any nocebo effect within the therapy. One of these ways is when a therapist inadvertently reinforces the client's focus on threats rather than resources within their lives, contributing to that nocebo effect. And that can happen through a number of ways. One is to overly focus on dysfunction, emphasizing dysfunctional thoughts and behaviors without acknowledging, positive growth can make therapy feel discouraging. For some example statements that a therapist might make are, let's go everything that's gone wrong this week, or why do you think you keep making the same interpersonal mistakes or choices? Well, very few of us would ever say such a thing. And another kind of way that a therapist could reinforce it is assigning rather pessimistic homework that centers on tracking symptoms or negative emotions or unhelpful negative emotions without balancing it with strengths may reinforce a focus on distress. For example, homework. We might say track all of your anxiety triggers without mentioning a focus on coping successes. Another way would be neglecting positive progress. If a therapist repeatedly focuses on problems rather than acknowledging improvements, clients may feel they're not making progress. And for example, we might have over tracking of negative emotions. For example, if the therapist says to the client, let's track every time you felt anxious this week, rather than integrating positive observations with that kind of tracking. How can we offset this? Shifting from a nocebo to a placebo effect in therapy. Well, we therapists can actively counteract the nocebo effect and foster a placebo effect by doing things such as encouraging positive and realistic expectations in the therapy, setting optimistic and yet really realistic goals, and reinforcing a hopeful therapeutic outlook can foster motivation. For example, with positive statements like, you're doing a great job with connecting with friends right now. I'm hopeful we'll see even more progress. Or another way might be both balanced homework assignments that focus on positive experiences, strengths, and coping strategies, along with challenges, encourage a more balanced outlook. For example, we might say something like, write about times you felt successful managing your symptoms this week. or even a therapeutic space. If we have a warm, inviting, kind of a well-organized environment, that may help create like a safe holding environment that feels safe and supported and enhances more positive expectations. One of the things that we can do at the beginning of therapy and at the end of the therapy is have frequent check-ins on positive changes. For example, we might say, what's one small thing that went well this week? Or what have you noticed that is improving within your life? By having that focus, and maintaining that focus on strengths, hopeful progress, and fostering a supportive therapeutic environment, therapists can help the clients avoid the detrimental nocebo effect and instead get the powerful benefits of the more placebo effect within therapy. Um, so let's consider examples of how language choices on the part of the therapist can shift the client's experience toward focusing on problems that would heighten perceived dysfunction on the part of the client and missing opportunities to reinterpret their experiences in a more helpful and actually even more empowering way. One of these ways would be, and let me just give several of these, about the language examples that would reinforce a nocebo effect. One, a nocebo inducing statement might be, let's focus on the problems you face this week. The negative impact of framing issues that way is framing them as fixed obstacles rather than situations that the client could work through, which can lead to a sense of defeat or helplessness. An alternative, more placebo-focused statement would be, let's talk about any challenges you encountered this week and how you handled them. The positive impact of that would be it emphasizes more resilience and more of a growth mindset, suggesting that challenges are things that can be manageable and temporary rather than overwhelming and that we are incapable of addressing them. Another way that a language on the part of the therapist may reinforce the nocebo effect, the negative effect would be labeling emotions as dysfunctional rather than neutral. A nocebo inducing statement might be, how did your anxiety affect you this week? The negative impact of that is that it reinforces the idea that anxiety is inherently negative, which could possibly increase the client's focus on uncomfortable feelings and amplify their perception of distress. Whereas a better way, an alternative placebo-focused statement would be, when did you feel a heightened sense of energy or alertness this week? The positive impact of this is that this approach can help clients to view arousal states more neutrally, encouraging exploration of how they can shift their interpretation from anxiety to productive excitement in certain contexts. There was actual research that was rather interesting on this, where they would have two different groups engage in doing singing in front of a group. And so they told one group, when you do this, you are going to feel very anxious. And they told the other group, yeah, you're going to experience excitement. So they kind of primed the clients. And it's not surprising that those who had the expectation that this would be anxiety inducing, when they stood up and sang in front of the group, they experienced anxiety. It was, it was very unpleasant. The other group, there was a greater tendency for them to feel this as more neutral and actually even positive, as something that is quite exciting. Okay, so one way that if we emphasize that can be harmful is if we emphasize dysfunctional emotions versus adaptive responses. A negative statement there would be something on the part of the psychotherapist would be your reactions this week were pretty much dysfunctional in social situations. When you say, well, that few of us are going to say something that egregious. But the negative impact of something similar to that is that it implies a fixed flaw within the client that can discourage growth and create a feeling of shame and even inadequacy there. Whereas an alternative, more helpful statement would be, how did your emotions help you understand what you wanted in that social situation? The positive impact of that is it reframes the client's response as a source of insight, in actually empowering them to see emotions as useful signals and supporting adaptive emotion regulation that that can be really, really, really helpful. One of the ways that we therapists can sometimes, you know, reinforce the nocebo effect is if we miss opportunities to reinterpret anxiety as excitement or arousal. This is similar to the one I already said, but an unhelpful statement on the part of the therapist might be, let's track all instances of anxiety so we can reduce it. It may sound hopeful, but the negative impact of framing anxiety as something solely to be reduced or avoided even reinforces that it is inherently harmful or not helpful or useful. Okay. But a more helpful statement on the part of the therapist might be, this week, let's notice situations in which your energy feels similar to excitement, and we can explore how that could be useful to you. Okay. So the impact of that is that the positive impact of that is it encourages the client then to view anxious arousal as potentially adaptive or helpful, paving the way to use arousal constructively in different contexts. For example, excitement when they're getting up and doing a public speaking, uh, uh, situation. The last one that I want to talk about is that wouldn't be helpful on the part of the therapist to say is framing threat as overwhelming rather than manageable. An unhelpful statement or nocebo inducing statement would be, it seems as though your life has a lot of overwhelming threats. Well, the problem with that, the negative impact of that is words like overwhelming can intensify perceived helplessness, making it seem as though the threats are, just insurmountable. Okay. And, uh, and so that won't be helpful. Another way, an alternative would be, what are some ways you may manage difficult situations? Let's explore for you what works well and how we can build upon that. Now, I want to then look at some more specific kind of language shifts that we therapists can use that will help foster a sense of resourcefulness within our clients. If we describe symptoms as something manageable, not overwhelming and absolutely permanent, right? So if we describe some symptom as something, if we do this in a very negative way, such as your depression has made life impossible to enjoy, hasn't it? Well, the negative impact of looking at that kind of emotion as permanent and is that you will not have complete control and you'll never have any control, and that will induce kind of hopelessness. A better, more alternative way there would be to ask something like, how are you managing your energy levels? Are there times when you feel a bit more engaged or hopeful? That is more encouraging the client to look for times when they feel better, subtly suggesting that positive, helpful change is indeed possible. Okay? Another way is when we attribute power to symptoms versus client control. A negative, unhelpful way to, that does this is if we say something like, your symptoms keep blocking you from having a good day. Well, the negative impact of that is that it personifies symptoms as obstacles, creating a sense of uncontrollable interference in our life. Whereas if the therapist says this in a slightly different way, such as, when do you notice moments of peace or control, even if they're brief? What do you think helps make those moments possible? The positive impact of that kind of statement is that it validates that positive experiences are accessible, encouraging the client to focus on instances where they do have some control. Narrative therapy does a great job in doing this. Another way that specific language can shift so that we foster a sense of resourcefulness is to move away from statements such as um, reframing negatively viewed experience, seeing negatively viewed experiences and moving towards viewing them as skill building opportunities. A negative way that a therapist might make a nocebo inducing statement would be, let's figure out why you failed to manage your stress this week. The impact is the term failed emphasizes, reinforces the idea of inadequacy and defeat. Whereas the alternative helpful statement would be, what are some stress management strategies that worked even a little bit this week? The positive impact of that statement reframes stress as an opportunity to try and improve upon coping methods, emphasizing growth rather than failure. Now I want to make a major shift in a different direction as we kind of end this webinar, and that is to look at environmental and contextual factors that support the placebo effect. Therapists can reinforce uh, clearly that we can reinforce a sense of safety, capability on our part, and hope by using that language, a language that encourages a broader focus on resources and strengths and adaptive interpretations of the experience. And, and of course, those are very important, but there are also other changes in the therapeutic approach that can do this. By having homework assignments that emphasize strengths. Well, we know from common factors research, right, that is, instead of just assigning clients, that is that we negotiate with the client's homework that encourages maybe noticing positive or helpful negative emotions or successful use of coping skills. For example, we might say something like, notice 3 moments of calm this week and what you were doing at the time, kind of a variation on solution-focused therapy. And that helps the client build awareness of positive experiences and resources. Another way would be checking in with positive framing. So we might begin a session with questions like, what went better for you this week? Or what's a small success you noticed? To set a positive tone that highlights growth and progress, promoting resilience and the placebo effect. One that I really like, and I often don't think about it enough, I'm beginning to be more aware of this, is creating a welcoming physical setting. Now, sometimes if you're working for an agency or something, you don't have a whole lot of control over what the setting is that you will be offering the therapy. But even there are some things that we can do within that setting that may help create this nice holding environment for our clients. Something comfortable, some warm therapy environment can reinforce that sense of security and openness. Even thoughtful details like the quality of the lighting, if there's warm lighting, uh, comfortable seating rather than really uncomfortable stuff, have more calm colors, encouraging relaxation, can reflect a client's level of care for the therapist's level of care for the client. And these small things, even just maybe having bringing a plant in there, or some curious art, abstract art, or something like that may help to do that. Another way that, and the last one I would probably want to cover here, is to reinforce skill building and small wins at the end of each session. At the end of sessions, asking, like, what skill are you working on, or will you be working on now and until our next session? What strengths will you be building this week? Leaves clients with empowering and kind of an empowering mindset that further engages hope and the placebo effect. Well, by fostering these shifts that we've talked about throughout this webinar, um, we can hopefully promote a more constructive, growth oriented therapeutic experience for our clients that supports the client's focus on their strengths and their resources, leading to a more adaptive and helpful therapeutic outlet. I hope you found this webinar helpful in some ways, and I would certainly enjoy hearing from you and about any other kind of webinars that you might like. And I want to wish you a good day and all the best. Bye bye.